Okay.
All right, ready? All right. Welcome. Good evening, everybody. Today is January 22nd, 2020, and it is 5:31. As a quorum of the committee is in attendance, I would like to call to order the Central Health Budget and Finance Committee. So, agenda item 1. Consider and approve the minutes of the November 13th, 2019 meeting of Central Health Budget and Finance Committee. Do I have a...
I move approval of the minutes of the November 13th, 2019 meeting of the Central Health Budget and Finance Committee.
Do I have a second? A second. All in favor?
Aye.
Any opposed? No abstentions? Any abstentions? All right, it passes. Agenda item 2. Receive, discuss, and take appropriate action on the presentation of Central Health Fiscal Year 2019 Financial Audit. Lisa Owens will be presenting along with our outside auditors, Maxwell Lockenritter.
Good evening, Lisa Owens, Deputy CFO. I just want to take a brief moment and introduce our third-party external auditor for our financial audit, Maxwell Lockenritter. And they will be presenting a preliminary draft of our audited financial statements and our 3 component units for you tonight. And then we'll be returning for the full board meeting next week. These the audited financial statements, as you all know, are presented in alignment with GAAP, the Generally Accepted Accounting Principles, and are a little different format than what you see on a monthly interim basis. But we are here for you in the next few weeks or week. If you have questions, happy to answer those as you go through the report in more detail. But tonight, presentation will be by the partner on the engagement, Jimmy Rommel, and Tara Honecki, who was the manager on the project. Take it away.
So good evening. As Lisa mentioned, we'll be going through the draft audit report for the fiscal year ended September 30th, 2019. So 2 documents were provided to you. One is the draft audit report, and then the other one is a draft of our governance letter, which is a required communication at the end of the audit. So we'll be going through some slides. It kind of gives a high-level overview of both documents, and as we're going through, if you have questions for us, just let us know. Just a little bit about us. And so this is just a basic overview of what's included in your audit report. So very consistent format from what you've seen in prior years. You have your audit report, you have the management discussion and analysis, the basic financial statements, the report on intergovernmental auditing standards, and then also included in your report are the component units, which is Communicare, CCC, and Sendero. So we are going to be issuing a unmodified or clean opinion, which is the highest level of assurance that we can provide as your external auditor. And then also, as I mentioned, the audit is performed under government auditing standards, and we noted no instances of noncompliance to be reported under those standards, and also no material weaknesses in internal controls as part of our audit. So this is the statement of net position, and just we'll give a kind of an overview of the 2019 results compared to 2018. There's a couple items that I was going to focus on that as far as the fluctuations year over year. So looking at the current assets, you'll see that increased about 18%. That's primarily due to short-term investments that are held by Central Health, and the increase is because during fiscal year 19, revenues exceeded expenses, so obviously you have more funds to invest. So that's the primary reason for that fluctuation. On the non-current assets, the fluctuation was primarily due to the additional $20 million provided to Sendero. And then also, the Central Health participated or is the administrator of the LPPF program during fiscal year 19. So there's about $12.8 million of assets that are included as non-current in the current year report that obviously wouldn't have been there in fiscal year 18. So that's the primary reason for the change there. Under current liabilities, the main flux is related to your accounts payable. That's merely because of timing. Obviously, when things are due, depending on when invoices come in, the timing of expenses, that number can definitely fluctuate, but that's the primary change between fiscal year 19 and fiscal year 18. And then on the non-current liability side, the main increase there is you have assets for the LPPF, and then you have a corresponding liability that basically zeroes it out. So once again, that would not have been there last year. But overall, an increase in your net position between fiscal year 18 and fiscal year 19. On the statement of financial position, kind of the main fluxes here on your lease revenue. So the primary reason is you get a contingent rent payment from Seton that's based off of their net patient service revenue. It's maxed out at $100 million times a certain percentage. They actually reached that $100 million this year, so that was an increase in lease revenue compared to fiscal year 18. And then on the expense side, healthcare delivery, the main flux is the payment made to the CCC was about $35.4 million in fiscal year 19, and there was only $23.2 million in fiscal year 18, so that was the primary flux there. And then you'll see down under the non-operating revenues, the line for other revenue and expense obviously had a pretty significant change from last year. The bulk of that, there was a $3 million loss on an asset that was part of the building that was leased to the 2033 LP group that was demolished. So obviously the asset's no longer there. So you have to write off the book value. So whatever book value you have is shown as a loss. So obviously not a recurring type of expense, but is reflected in your financial statements in fiscal year 19. But overall, an increase of about $29 million in your net position in fiscal year 19. And then just kind of some other financial highlights. I mean, as part of our audit, we look to see that the cash is fully collateralized, which it was during the year. We also look at the Central Health's compliance with the Public Funds Investment Act, and we had no concerns or issues with that this year. Overall, the Central Health debt balance was about $8.4 million at the end of fiscal year 19, and about $1.1 million in principal was due in fiscal year 20. And then, as we mentioned before, the LPPF, which if you look in your draft report, footnote 16 has a little bit more language about that, which obviously is new this year compared to last year's report. And then, as I mentioned, the other document that we handed out in draft form tonight is required communication as part of our audit. If there's any kind of changes in accounting policies, that will be disclosed in here, and there were none during fiscal year 19. We had no difficulties in performing the audit. We definitely want to thank Jeff, Lisa, everyone else that helped, Karen, everyone that helped us with the audit this year. We had no audit adjustments as part of our audit this year, and then no disagreements as part of our audit. And then when we present the final report and governance letter next week, attached to the governance letter will be the representation letter that management of Central Health would sign that indicates that we were given everything that we needed to perform and complete our audit this year. And then, as I mentioned earlier, as part of our audit, we do review internal controls to see if there's any either recommendations or possibly anything else we need to communicate to the board. And as I mentioned, there were no material weaknesses in internal controls based on our audit this year. And with that, I'll open up to any questions you guys may have for us.
Well, this is obviously the type of audit we like,
Yes.
so thank you for doing this. I do want to open it up for questions, but if y'all have questions about numbers in the financials, that's really probably more of a Jeff, Lisa question. If y'all have questions about, audit processes or, that sort of thing, that's the MLR sort of question. But do y'all have any?
It's not a question, it's just, I guess, a concern. So this is financial audit, it doesn't look at the overall operation, it's the numbers.
Right, this is just the financial audit piece. Yes, sir.
They're assuring that we have not materially misstated our financial statements.
Right.
Yeah. Yes, indeed.
Okay, I'm sure we haven't overstated our financial statements, but under other matters, in this, is this part of this, or is this something different? The MUD, is that a different document? It has nothing to do with this?
No, I think we identified it's got the wrong entity at the top.
Yeah.
The body of the letter does apply
To us.
Okay.
Yes,
Yes,
Yeah.
yes, that is not.
I saw
okay.
MUD, and I'm
Yeah,
like,
yeah, this time of year, we got a lot of reports going out, so we apologize for that, but yes, the format of the letter is the same.
Water.
But yeah, as I mentioned, this is the communication to the governing body, so we will definitely get that corrected and fixed before.
I appreciate that. And so under other matters, since I'm not an accounting expert or near a financial expert either way, So what is the required supplementary information, RSI, that supplements the basic financial statements? When it says that your procedures consist of inquiries, does that mean like verbal inquiries? You just sit there and talk to management regarding the methods of preparation of the information? And as such, then you don't really audit, or, because it says, we did not audit the RSI and do not express an opinion to provide any assurance on the RSI. What does that mean exactly for me?
So the management discussions and analysis is required by the Governmental Accounting Standards Board as part of, and that's who oversees governmental audits. And so they require that to be included. And so what we do is we do make inquiries with management as far as the information that's in that section. And we're reviewing that and looking at to make sure.
And the section is the general fund.
Well, the section is
It's
the
not, okay,
yeah,
just curious.
just the management discussion analysis. But we
Okay.
are comparing numbers that are included in there to the actual financial statements. But the MD&A is prepared by Central Health Management.
Okay.
And so there is language in there that, we're not going to provide any assurance on because it's more, operational highlights, things that are not necessarily we can audit. But
That's why you don't
figures are definitely tied
include it. I get it.
back to it. But it is a required to be included in the final audit report under Government Auditing Standards Board standards.
Is that, I'm just assuming that that's a normal course of
It is.
Yes.
business.
Yeah.
Okay, thank you.
They,
Thank you very much.
You're welcome.
GASB and then GAAP come up with the standards for public entities for their accounting, and they made changes probably about a decade ago, about now, to require this management discussion analysis that the management of our organization provide context.
Yes.
But it's not the financials that they're auditing, but it's part of the comprehensive, what they call the CAFR, comprehensive annual financial report. You include the management discussion and analysis with the audited financial statements.
Thank you, Sherry. Madam Chair. Thank you.
Yeah, you're welcome.
Any other questions? All right, thank you. Thank you so much.
Thank you.
So I believe this agenda item has a motion.
Need a motion?
Yes, Dr. Bell. Thank you, Dr. Bell.
Uh,
Star student tonight.
I move that the committee recommend that the board accept the audit as presented by Maxwell, Locke, and Ritter.
Second.
So we have a motion and a second. All in favor?
Aye.
Any opposed? Any abstaining? Motion passes. All right, agenda item 3. Receive a report on the December 2019 financial statements for Central Health. Lisa Owens will be presenting.
Okay, good evening. As I talked about last month, we were here with our first quarter of financial results for Central Health. And as you know, we had a lot of changes in our healthcare service delivery program this year, and are contracting directly with several new providers. And so the format of your financial reports has changed, and we're hoping to get feedback from you about this over the next couple weeks as we continue to fine-tune things, and even bring forward additional schedules next month, which I'll talk about towards the end of the presentation. We have an index for you now because there's a lot more information. We have a lot more detailed slides that as we go forward, maybe they're just for your reference. If we have specific questions, we could refer to those. But we will focus on our 2 programs, which are healthcare delivery and administration. So a few highlights. We are presenting through December 31st. As you know, property taxes are due January 31st. So December and January are very large months for us for healthcare delivery for tax collection. And we had a strong tax collection in January of $92 million year-to-date, with $82 million of that being collected in December. That is about 42% of the adjusted tax levy. We have continued to fund the IGT program for disproportionate share. That year-to-date is $9 million. And then our healthcare delivery program is at approximately year-to-date $33 million. And I'll go into a little more detail on that and the new contracts that are in Central Health. We do have a restricted balance in the LPPF as of December 31st of approximately $2 million. I believe the board approved the LPPF motion last week, so we'll continue to see inflows and outflows from that fund as we move forward. And then when the financial statements are finalized for fiscal year 19, we estimate and calculate our final contingency reserve carry forward. And you'll recall that that is our healthcare delivery that's available for timing differences, planned changes, such as when we knew we would have a decrease in lease rent. And that was estimated to be $56.5 million when we were preparing the budget, and ended the year at $64.9 million. And when we get to the sources and uses, I'll walk through that again. So our balance sheet, as you saw for the September 30th, continues to have a strong position as we carried forward cash and short-term investments. Year over year, it is at about $60 million year over year as of December 31st at $154 million in short-term investments. Additional tax revenue does play into that. We do anticipate about $16 million additional dollars in tax revenue this year, and just came into the fiscal year with a strong cash position. Other restricted cash and investments is year over year similar, $119 million. The difference, only big difference being that we do have that LPPF cash that is restricted, and then total capital assets of $110 million. Total assets as of December 31st are at $524 million. As we look at the liabilities, we have some liabilities of $138 million. We do have a variance in our accounts payable. You'll see this steadily throughout the year. This is going to be higher this year naturally as we have more contracted providers in the organization. So a lot of that, $8.6 million of that is accounts payable to contracted providers. About $1.2 million is vendors, which is operating costs. Deferred tax revenue, we do record the tax levy October 1st as it's levied. So as the tax revenue is received, you'll see that deferred tax revenue go down, but we do anticipate additional $125 million in tax revenue. And total current liabilities are at $138 million. And again, as our tax revenue is collected, that will go down throughout the fiscal year. Total liabilities with our restricted LPPF at about $2 million, and our debt service are $148.9 million. And again, total liabilities and net assets, $524 million. So looking at our sources and uses, as I mentioned, we collected approximately $82 million in tax revenue in December, as well as lease revenue and other revenue. With a strong cash position, we continue to have strong interest and earnings income. And then in the year-to-date column, you'll see we recorded the $64.8 million in contingency reserve carry forward for healthcare services. Our healthcare delivery, we have a lot of additional slides on this, but year-to-date is at $33 million, and we'll walk through the changes from this year to last year. Last year at this time we were at about $62 million. And then our administration program is at 17%, and we're about 25% of the way through the year. 17% of our budgeted expenses at $1.8 million year-to-date. Tax collection expenses do kind of rise as the taxes are collected. Those fees are incurred, so about $587,000 year-to-date, which puts our total uses year-to-date at $35.5 million, and our total excess sources over uses at $124 million. Looking at our next slide, we have a healthcare delivery summary slide, and we're hoping that you find this useful. It's a little bit more detail on our healthcare delivery. Year-to-date, as I mentioned, is at $33 million. This gives the categories that we talk a lot about in our financial reporting historically, as well as there there's, different programs with our campus redevelopment and the ACA programs that the board has traditionally liked to see drawn out. But our IGT, again, for the DISH program, is at $8.7 million year-to-date. A little bit more detail on healthcare services. As we traditionally break these into primary and specialty care, you'll see that primary care and pharmacy and specialty care all in the 25% range year-to-date, as we've begun contracting with new providers in that space, as well as all other healthcare services, which includes, we have more detail for you on additional slides as well. ACA premium assistance and enrollment. I think we had an update last month about the enrollment in that high-risk program. So our monthly expense this month was about $500,000. You will see that go up significantly next month as we have additional premiums that start in January to support that program, which has been very successful. So we are at about 16% of our budgeted $9.8 million for the premium assistance programs and the ACA outreach. Our healthcare facilities and campus redevelopment at about 11% of our year-to-date expenditures. Again, this is another area I think we're going to start to see things changing rapidly as we are hoping to begin some new projects, as well as the demolition on the campus. And then finally, the healthcare delivery operating costs, which includes the departments, as well as the services to provide eligibility and enrollment, as well as other healthcare services to our patients and their families, is at about 14% of our year-to-date budget at $3.5 million. So our total year-to-date healthcare delivery is at $33 million. And just to highlight the changes from last year, you'll see a swing in the IGT. We're spending less there as the uncompensated care program is now funded through the Travis County LPPF. You're going to continue to see an increase in our healthcare services, and then in our debt reserves and transfers. Last year at this time, we had transferred $20 million to Sendero, and with our investment in the ACA high-risk program, you'll see those expenses now go up in that line item. So just a few changes on how the numbers will look year over year as we go forward. So I'll just quickly go through the last few slides. We provided what we're calling our details for healthcare delivery, and this is where service lines are outlined in much more detail, details on IGT year over year. Our healthcare services are broken down by primary care, specialty care, pharmacy, post-acute, reproductive, and sexual health, as well as our reserves and hospital performance incentives and indigent care. As you see, this is just more detail on those, and it's a little more consistent with the CCC as we get a little bit deeper into the specialty care. On slide 10, we also are providing you with a lot more information on the the 3 areas. Again, ACA and premiums. We've broken out the high-risk program and the CHAP program, which we've had for many years, as well as the education and enrollment services. On the healthcare facilities and the campus redevelopment, again, you'll start to see other goods and services and consulting services go up as projects go underway. That's really the campus redevelopment, Eastern Travis County development projects. Healthcare delivery operating costs, as I mentioned, are departments that are delivering eligibility services, as well as analytics and strategy, community engagement programs. And then finally, our debt reserves and transfers. So a lot more information there. And then the last 2 slides, which I won't go into detail on tonight as we're early in the year, but our primary care services detailed by primary care provider, as well as our specialty care services by specialty care line. I'm happy to answer any questions, but those are just the very detailed slide. As we get into the fiscal year, we'll start to see fluctuations in that and present more information. So That's our new format. The one thing that you'll see that isn't there is year-over-year comparison. And we are working on a report for you that looks at healthcare spend throughout the enterprise, as well as those year-over-year contracted services. So that more to come as we proceed through the fiscal year.
Questions? Cynthia, I'll start.
Just curious as to where would you incorporate the map and map basic costs, the spend? Where would that be?
Well,
So that I can see how,
so
how
if,
that
are
is-
you saying if the map and map basic costs go up, where would we see that in our
no,
financial?
I want to know where they're incorporated. Where,
Spending it.
where are you,
We're
is it
spending
called
it in our-
indigent care?
Uh,
Or where is it here? So that I can see, are we really going up? Are we enrolling more people, you know, et cetera, et cetera? That's what I want to know.
So those services are provided through the network that we've
Throughout the
established
network?
of contracted providers. So you would see that in our contracted providers,
In the
not in
healthcare?
a specific line item. Unless there was an initiative that was a project, but our contracted, we reimburse our contracted providers for serving MAP and MAP basic patients. And so you would see that in our primary and specialty care contracts.
Okay, then I guess what I can do is ask you,
Uh-huh.
I want to know numbers. You know, this is what we have in MAP, this is who we have enrolled in MAP Basic, and how that's increasing year to year.
So that's, you want to see utilization of
Yes.
the MAP and MAP basic program?
Yes.
Okay. So
Thank you.
I can, Jeff's coming up,
Oh,
but
yeah.
that's
I was
we
just
can
gonna- I was just
talk
gonna
about
say,
utilization.
Yeah, we'll start looking at, I think there's some conversations in the strategic plan, looking at some of the dashboards and some enrollment numbers. So
Yes,
we'll work on-
especially since there's so many more people that are not insured. I mean, this is
so
it's
we'll
gonna be a
work on
tough year.
Providing that information to them.
I appreciate that. Thank you, Jeff, thank you, Lisa.
Even if it's one of those supplemental, you know,
Mhm.
Sheets, yeah.
index pages, that would be
Okay.
great.
Yep.
Yes, I don't know if this is the time to ask a question or not, but I think our strategic planning committee meeting, we asked the question as the redevelopment of the campus, the Breckenridge campus, and the amount of revenue that we are generating beyond what is, I guess, is budgeted or what we anticipate. What we're trying to get at is, as a result of the city's changing its own zoning processes, there are going to be some significant increases in the revenue that will be generated in the CBD, in Central Business District area. Part of that will accrue to Central Health property there. What I'm trying to ascertain is there any way we will be able to measure that as we build, develop, whatever, so that we can say that additional revenue is being actually used and derived and directed towards increased health care. I don't know if that came across clear,
I
but
think as new developments or projects are brought online, that's something we could ask for in a pro forma or trying to tell that story. With our current ground leases, we can look into if that would impact them. I don't know that it would.
yeah.
But I think as we have future projects coming online, as we develop pro formas of what revenue could be generated on the campus, we
What
could look at the
additional
streams,
revenue?
the additional revenue that would be received by Central Health?
Right.
Okay.
Because I hear from the community that, okay, the city is reassessing its tax base, and all of this additional revenue is going to be coming in. What is the benefit to the community that will be derived? And it seems to me we could be ahead of the curve by asking those questions, developing some kind of reporting mechanism, even though it may not be annual, but whatever the frequency, so that we can share proactively with the community.
Okay.
Forecasting?
Because I'm sure we're going to get that question.
Yeah, yeah.
Benefits.
Mike's gonna address
Yes,
this.
and in addition to what Lisa said, and Manager Jones, you're absolutely right. What we'll present to you will be a set of pro formas on a projected basis, where you'll see the success, meaning, have we hit the pro formas or not, it'll show up in the real estate revenue lines and the revenue section of the financial statements. We can have all kinds of supplemental reporting that goes along with it that really dives into the details, but you'll be able to see and track in real time, annually, maybe semi-annually, here's what this development, once it starts turning more revenue, what it's actually yielding relative to projections, and it shows up in your income statement.
And I think it'd be helpful to say, as a result of this increased revenue has resulted in X number of dollars that have come to Central Health that we will use to do some of these other initiatives we're talking about. Because I think that's got to be a correlated statement. It can't be, well, we've got all this revenue, we don't have any plans for it, sort of thing.
Are you talking
You don't
about,
want-
sorry, go ahead.
You don't want cash just stacking up, and we're not,
Right,
I mean, we need a reserve, but at the
right,
same time,
right.
we're
But
putting it.
we have to show that we're utilizing that other than just reserving it for the future. There are some benefits that are accruing now or will accrue not shortly.
A lot of reserve policies, yes, sir.
So are you talking about, like, as we develop the downtown campus,
Right.
what we actually receive in revenues, or are you talking about the increased property tax base as well?
Well, both, really. My interest is the increased percentage, or whatever that will be, so that we can say, as a result, we've got, I'm just pulling a number out of the air, let's say $2 million, just using it. Well, that $2 million went for the enhancement of healthcare in certain, wherever it is.
Oh, so you want to, like, maybe earmark it, perhaps?
Well, I don't know if we can discuss that now, but I do think that's where I'm headed,
Okay.
is if we can do some earmarking for some of this additional revenue.
Cynthia?
One of the things, just to follow up on what you brought up, one of the things that we talked about a long time ago, when we were first talking about the master plan, is showing the community benefits. Are we going to have a community benefit package? Remember? And so I'm assuming that is what you were referring to. And I didn't know whether or not on the current construction, as we're looking at this, the construction in progress under capital assets. That is, do we know, are we talking specifically about, because I'm assuming it's all construction throughout the enterprise, if I'm not mistaken, correct?
All
Or just central
construction
health?
that Central Health funds.
Okay,
And
so do we know what we're funding?
Yes, so those are projects that are in progress, and when the project is completed, those dollars would be capitalized as allowable. And so,
Maybe it would be maybe under here, or in a separate sheet, it's under construction in progress. These are the projects that we're currently funding right now,
okay.
so we can see where they're located.
Well, to that, I know we had a capital budget, right, a capital improvements plan and capital budget with discrete projects. So are you referring back to that, Cynthia?
That and
Yeah. It
Yeah,
would
we
probably
can
be good to.
Bring a report to that next month.
Right,
If you
I
want,
think-
how we're doing.
And we may want to talk about like quarterly, do we
Okay.
get an update? I think
Don't need
on
it
that
every
would be a
month.
good idea perhaps.
Yeah.
Okay.
Back to Manager Jones' point, I think a couple things, if I understood you correctly. With the development that will occur, there's a benefit to Central Health as far as increased revenue, and normally that would go just into our general fund, but you want to be able to track that and show how it directly went to benefit or healthcare provision. The other thing I think you brought up that's a really important point is that the city will be getting increased revenue in the way of property taxes from our development. So I think that that's another important point, right?
Right, because as a taxing authority,
Right.
we should be able, or should say, because what's happening is, part of this is driving the cost of people out of the city of Austin. And so those folks are going out into other parts of the county.
Yes.
There should be a benefit from that increase to those residents and other residents. And I'm just saying we should try our best as we can to reflect that by focusing in or earmarking or whatever you want to use to say, as a result of these efforts, we're increasing services, we're building new facilities, we're doing those types of things in these areas that are benefit as a result of this tax.
And one other thing that I would just add, I know Ms. Cavazos in future meetings is going to be giving us some briefings on that development and on community benefits. So we'll be having more discussions on that, I know, in some future board meetings.
I didn't know whether or not you're still participating in the joint, or is Central Health participating in the joint committee? county, city, school district, blah, blah, blah.
Yeah.
Just keep in mind that we are talking about the financial
The
statements.
only reason I'm bringing that up is because if we are, which I would hope that we would be somehow another
Regional
participating.
Affordability Committee?
Yes.
Yes.
We would be able to see and not hold them liable or hold them accountable for the monies that they're raising and are they spending, because that's really not our role, except when entities come to us for funding. So under new initiatives, when they come for us for funding, we need to make sure that the other governmental entities are put to task and spending the monies that they're gaining to use in the communities where they have been displaced and moved to areas where there are no resources, no clinics, no food, nothing. Okay, so sorry, Holly.
It's hard because I think you want a lot of qualitative analysis on the numbers.
That's right.
And that doesn't always fit in your financial statement.
Right.
Any
Thank
other
you, Lisa.
comments or questions? All right, there's no motion on this one. So agenda item 4, receive a report of the December 2019 financial statements for the Community Care Collaborative. Lisa Owens again presenting.
Okay. Okay, so for the CCC, we do have just a few highlights. Cash is at 18.6 million. We have liabilities of 8 million as of the December, and net assets at the end of December are $11 million. So just briefly looking at the balance sheet, our total assets as of December 31st are $19.1 million. We have accounts payable and accrued liability, which includes payments to providers and contractor providers in the CCC. We have deferred revenue, which is an estimate for potential DSRIP projects. And then total liabilities of just about $8 million for net assets of $11 million. Total liabilities and net assets at $19.1 million. Looking at our sources and uses of funds, we did, as I mentioned with Central Health, also for the CCC, as those September 30th financial statements are being finalized and the final audits are being completed, calculate the operation contingency carry forward. It is at $10.7 million, which is about $5 million higher than expected going into fiscal year 20. Our total sources of funds year to date is that operations contingency carry forward, as well as some interest income of $75,000. Our uses in the healthcare program are just at $4.6 million in both healthcare services as well as our DSRIP project costs as we continue to fund 3 performing providers in the CCC through our DSRIP program. Just a high-level update on the uses of funds in the healthcare delivery program. The budget this year for healthcare delivery was $19.6 million. We are just starting to spend some funds in primary care and transportation. Specialty care is at 13% at about $520,000, and our specialty behavioral health, which includes our inpatient hospitalization and other services through integral care, is just at $2 million, which is about 25%, as well as urgent and convenient care at 16%. Total expenses here at $3.9 million. And we are working on, as I mentioned, comparing primary care and specialty care contracted providers in a separate report. So we would have more detail on these contracted providers next month when we show you that analysis. But I'm happy to answer any questions.
Just one. In general, has the CCC already been absorbed completely? I'm just curious. Into Central Health?
Yes. Yeah.
It may be best to talk about that under number 6.
Okay. Thank you.
You're welcome.
I had a similar question. So. Any other questions?
I just-
Yeah.
So Lisa, my understanding is that what you're preparing for us, and thank you for doing this, I know it's a lot of work, is a report that will show us apples to apples, right? Because what we had is some monies that were previously showing up as revenues, expenses under the CCC budget, but now with the changes are now showing up in our budget. And so what you'll do is a report that takes that and the current and tries to give us an apples to apples of last year and this year. Is that what you're working on?
Well, I think we continue to provide healthcare delivery in both organizations.
Right.
And so we want to show the totality of our
Exactly.
healthcare delivery expenditures and compare that to last year's
Right.
totality. But knowing that our programs and our specialty care and our primary care continues to evolve, that will also look different this year.
Sure.
But it's an opportunity to look at the totality of the healthcare delivery that we're providing through enterprise partners.
Right.
So maybe there's an opportunity to just do a supplemental report that kind of combines them. So you'd have a column
Right.
for central health, column for community care. I'm talking about like merging last year's
Right.
information.
Yeah, and I think we'd like to look at service lines because
Right.
to the point,
Right.
to the
Right.
questions
Right.
about utilization and service delivery, we'd like to keep that approach
Yes.
as we continue to develop
Yes.
our reporting on our utilization and the service delivery to our patients through the
Yes.
network of contacts.
And that way we
have.
can look at apples to apples.
It's going to be challenging.
Yeah. Thank you.
I'm sorry.
Okay.
All right.
A lot of work.
No other questions? Okay. No motion necessary on that. Thank you, Lisa. Agenda item 5, discuss and take appropriate action on a presentation on the fiscal impact of a $15 minimum hourly wage for Central Health Enterprise employees.
Good evening. I don't actually have a presentation. I provided a memo, and you all asked for me to analyze the salaries and possibly move the minimum pay to $15 an hour. As the memo states, that impacted 43 employees, primarily from the community care area. Just moving them up to the $15 an hour, the impact is $46,424. $46,424. In the review, it's easy just to bump people up to the $15, but what happens in the middle, it's a domino effect.
Right.
And so what I'm asking of you is to allow us a little more time to be able to look at this a little closer and provide you with a true analysis of what the impact is. We have to take, so the $15 jump here would impact about 5 grades. So the compression between those grades it's a lot. And so I'm asking that you give us just maybe about 3 months, and I think in those 3 months we will have completed a market review. We're also, which I think is going to help bump those salaries up anyway. And then the second thing we're doing is we're taking a closer look at our cost sharing on our medical plan. So I think that's also another thing that I can bring to you all sometime in the spring.
I think that's reasonable. And we talked about it, and I was, instead of just going immediately and saying, yeah, we're going to lift everybody and then have this compression issue and freeze things, I was like, it probably makes a lot of sense to be a lot more thoughtful about this, to bring in the market survey, and let's really kind of equalize kind of everything in the totality.
Correct.
Yeah. So, question?
Well, in doing that, would you be able to bring back also, once you've made your analysis and recommendation, a profile, a more current profile of sex, race, and in terms of what that will look like after that has been completed?
Absolutely.
That's a good idea.
After the market review,
After-
yes.
yes.
Yeah, we'll want all of
Yeah.
that. That will be in the report, right?
That will be now.
Yeah.
Yeah, I will
Exactly.
include it in the report.
That's at all levels.
Yes.
Yeah, that's what I was trying to ask,
Yeah.
so we can.
At all levels.
see where-
Yeah.
Yeah, at
Right.
all levels, yes.
Yeah, I think that helps. Thank you.
All right.
Any other questions? I think we do have a motion on this one.
I move that the committee direct staff to further analyze in collaboration with management of Community Care and Sendero the impacts of increasing the minimum wage for all employees of Central Health and its related entities to $15 per hour.
Second. All in favor?
Aye.
Any opposed? Any abstentions? All right, motion passes.
Thank you all.
Thank you. All right, agenda item 6, discuss and take appropriate action on the 1115 Medicaid Waiver Delivery System Reform Incentive Payment DSRIP projects, the Community Care Collaborative, including healthcare delivery arrangements and other community partnerships. Monica Crowley and Jeff Knodel will be presenting. All right, we're going to go into executive session, right?
Yes.
All right. I announce that the board is convening in closed session to discuss agenda item 6 under section 551.085 of the Texas Government Code governing board of certain providers of healthcare services. In addition to Travis County Council, Mr. Giesland, Ms. Cavazos, Ms. Crowley, Mr. Knodel, Mr. John Morgan, and Ms. Owens may remain in the closed session. is January 22nd, 7:10, or January 22nd, 2020, 7:10 p.m. We are coming out of closed session. Agenda item 6 was discussed. No motion is necessary. So moving on to our last agenda item, number 7, confirm the next regular committee meeting date, time, and location. Managers, our next regularly scheduled Central Health Budget and Finance Committee meeting will be held on Wednesday, February 19th, 2020 at 5:30 p.m. at the Central Health Administrative Offices, 1111 East Cesar Chavez Street, Austin, Texas, 78702. At this time, I'm ready to accept a motion.
Adjournment.
I knew you were going to do it. Second, so motion, a second, all in favor?
Aye.
Any opposed? Abstentions? All right, thank you all.
Manager Alden?
Don. Yay!